Hi, my name is Shaniqua Walker Barnes. Many of you know me as Dr. Shaniqua. For those of you who don't know me, I am an ordained minister, a licensed psychologist, and a pastoral care professor. Most of my public ministry is around issues of race and gender justice, but today I want to talk about pastoring during the coronavirus pandemic. As a licensed psychologist and a former behavioral science researcher who primarily works in religious settings, I think I have a bit of a unique background to bridge the world of science and the world of faith. So I thought I'd use that to speak to pastors and religious leaders about what you can do and should do during this pandemic. There are some very clear things that churches and congregations can do to help the situation. And there are also some clear things that churches and congregations can do to hurt. So first, let me give a disclaimer. I am not a medical or a public health professional, so none of this is to be taken as medical advice. I am speaking as an individual, and I am not speaking on behalf of any agency or institution, including my employer. Also, as a Christian, I will often use the word church when I talk about this, but I think what I'm going to say here is applicable to any religious organization that gathers for communal worship, instruction, or spiritual practice. So this is also directed to masjids and mosques, to synagogues and temples, to sanghas, etc. So first, let me talk about how churches can hurt. The main way that churches can hurt during the coronavirus pandemic is to do business as usual. Watching this public health nightmare unfold, I have been floored and shocked by how many congregations are planning to continue to gather for worship on Sunday, even after the U.S. president has reluctantly and belatedly declared a national state of emergency. It's important to note that COVID-19 is not the flu. It seems to be more contagious and more deadly. And as of this recording, there is no known method of treatment. Please heed that. When organizations such as the CDC and the World Health Organization say that there is no known treatment, it means that there is no medicine that has worked on the tens of thousands or well over the 100,000 case mark around the world now. I suspect that hospitals have been throwing everything at their disposal at this disease, and it's not working. This is a new thing, a new disease. Our bodies are overwhelmed trying to figure out how to fight it because they don't have any natural immunity to it. And our medical centers are overwhelmed with the number of people who need care. There are some people who are especially at risk. The magic number that I keep hearing is 60 in terms of age. The CDC says that older people are at increased risk of the disease becoming serious if they get infected, and the risk increase with age. So the more over 60 you are, the higher chance you have of getting a serious case of the illness if you're infected. In addition, people with pre-existing health conditions are at a heightened risk of having more serious complications from the disease. That includes heart disease, diabetes, lung disease, HIV, and autoimmune disease. Now, many people hear the terms autoimmune disease or immunocompromised, and they don't know what that is, including people who have some of those conditions. So that includes medical conditions like rheumatoid arthritis, lupus, multiple sclerosis, and inflammatory bowel disease or IBD or IBS. So think about that from a congregational setting. People ages 60 and older, and those who have diseases like diabetes, arthritis, heart disease, etc., they're the ones at increased risk. If you're a pastor, and especially if you're a pastor of a Black church, that probably describes about half of your congregation. They're older, they're 60 or older, and they have at least one of the health conditions that it puts them at increased risk. So it's a high risk. Church is an automatically high risk crowd. The CDC says that people who are at high risk should avoid crowds, and communal worship is the very definition of a crowd, even if it's a small congregation. One definition of exposure says that being exposed in a significant way in a public health setting means spending 10 minutes within 6 feet of other people. So in worship settings, people are gathering for a prolonged period of time where they're in close contact with people. Now, are people gathering in other places? Yes. I just touched my face. People are at risk when they go to the store to stock up on supplies or to get gas. People have been talking about that and saying, if they can do that, why can't they go to church? We can't completely eliminate our risk. Every one of us is at risk, but there are different types of risks, some of which we can control, some of which we cannot. The CDC literally has a chart documenting different types of risks. So walking by someone or being briefly in the same room is considered low risk. So when we go out to get supplies and we have to wait in line a few feet away from someone, we're at risk. But hopefully we're in the low category. But when we're in close contact, less than 6 feet away from someone for over 10 minutes, we are raising our risk considerably. The shortest church services I know are about an hour long, and they have us sitting within inches of multiple people. We are literally surrounded by people, front, back, side to side. That's just sitting there. That's not even considering churches that are passing the peace or having communion. There have already been cases in New York and DC where entire worship communities have been exposed by a single individual, somebody who didn't know they were sick. They were just doing the faithful thing of going to church or going to synagogue. And they realized later that they were sick, and maybe they had exposed 50 people, I think in one case. In another case, they'd exposed 500 people. Churches in particular are commanded to tend to the needs of the most vulnerable. In this case, the most vulnerable person may be that 70 or 80 or 90-year-old church mother who has arthritis and diabetes, and she loves her church with all her heart, and she believes that a good Christian should take advantage of every occasion to worship God. So if the church is open for worship, she's going to be there. It doesn't matter that maybe her doctor thinks she shouldn't be there. She is going to be there. So in this case, good pastoral ministry may mean helping to make that decision for her, cutting down the worship service so she cannot be exposed in that way, cutting down the worship service so that she can't put other people at risk in that way. But it's not just about her. Another way that the church can hurt is by contributing to the public health burden. At this point, you may have heard the term flatten the curve. Essentially, since there's no way that we know of yet to prevent or treat this disease, the main strategy is to try to spread out its impact. The idea is that most of us are going to get it. A good number of the population is going to get this disease. But when thousands of people get seriously ill at one time, there are not enough hospitals, medical professionals, or medical supplies to take care of them. Hospitals are forced to make decisions about who to care for and how much care that they can give. They are going to have to make decisions about who to help. The guess right now is about 20% of people who are affected with coronavirus will get sick enough to need serious medical intervention. So let me give an example. I live in a county, a fairly large county, the fourth largest in the state. It has 700,000 people, but there are only 2 emergency rooms in this county. If even 10% of us go to church tomorrow, that's 70,000 people. Now imagine that 20%, only 20% in the congregation, get sick because of exposure at church. Well, that's 14,000 people. Now, imagine that 20% of those who get sick are serious enough to need to go to the emergency room or some other medical setting. That's 2,800 people. And because those 2,800 people got sick in roughly the same time, around the same time, Sunday morning, they are going to show up for ERs at the same time. 2,800 people, 2 emergency rooms. Now, if churches don't meet, will people still get sick? Yes, but perhaps more gradually, because they aren't contracting the disease in large group settings. That's why the school systems, colleges, and universities are closing. They're not saying that closing prevents anybody from getting the disease. They're trying to prevent the public health crisis that will come if large numbers of people get sick at the same time and need care at the same time. They're trying to flatten the curve. We need churches to do their part in doing the same thing, help flatten the curve. So that's how churches can help, can hurt. but churches can also help. Canceling the Sunday morning service does not and should not be the end of a church's ministry. People still need church. They still need community. They still need prayer. They still need a word. And the church should give that, but in a different way, not by having all bodies in the same room at the same time. Some churches are doing this by going virtually with people gathering via Facebook Live, Zoom, WebEx, or some other sort of live streaming. That's a great solution and one that many people can access. But I do want to remind you that there are also people who can't, and we need to be present for them too. So make sure your virtual solutions also have a call-in option for people who aren't social media savvy, or if internet services get clogged from too many people trying to access them at the same time. So make sure there's a phone number. And remember that the word is not limited to being preached in a pulpit. Do a prayer call during your normal Sunday gathering, during your midweek Bible study. Do some type of brief teaching. Go old school, burn a CD or DVD with a message and have somebody deliver it to the homes of your seniors and of your shut-ins. Whatever you do, send information out via multiple means. The church listserv, its Facebook page, its website, and also put up some old school flyers on the church doors that have phone numbers and other important information. Churches might need to diminish their worship ministries at this time, but they need to heighten their pastoral care ministries. And this is a great opportunity to engage the entire congregation in ministering to each other. So where are your deacons and deaconesses, your church mothers, your lay leaders? On Sunday morning, maybe they can't gather together physically, but maybe that church mother would be willing to call 2 or 3 people in the congregation throughout the week or on Sunday morning and ask them how they're doing and what they need, and if there's any way that the church can help them in this time of crisis. Maybe she would be willing to lead the prayer call, or even just to give a word of encouragement. Because I think one of the things that we need right now is encouragement and wisdom from elders who have come over the path that with tears has been watered. So finally, one of the biggest ways churches can help is tending to the material needs of the least of these. And the least of these is a much broader category than we're thinking right now. It's certainly the poor and the homeless, but it's also the children and the families and the working folks in your mix. As daycares and schools close, families are in need. Some parents will have to continue to go to work and they need someone to care for their kids. Some families need access to the internet and computers so that their children can do their virtual homework. Some families are homeless and they need a safe place for their children to stay during the day where they can get 1 or 2 good meals. There are homebound people of all ages who need someone to shop and deliver groceries precisely so that they don't have to go out and place themselves at greater risk. And there are self-employed people and precariously employed people and people working in the gig economy who've lost income already from this. They've had things canceled on them. They do not know how they're going to pay their mortgage or their rent over the next few months. There are programs like Meals on Wheels and food pantries that are already getting stretched to the brink as people can't find or afford the supplies that they need in grocery stores. Be the church for them right now. So as you go forward, be careful and be caring for those that you see and those that you don't. Be wise as serpents. Be safe. And may God's grace be with you.